Thanks for joining us today. Welcome to the video series on the 5 functions of developing a theory of change. This series is produced by the Capacity Building Center for States and funded by the Children's Bureau. In this module, we're going to break down the 5th and final function in developing a theory of change, documenting assumptions and rationale. Through the process of developing a theory of change, the team has gathered the problem statement, root causes, target population, and identified a long-term outcome. They have developed the pathway of change, including causal links, and defined the actions that are needed at each link in the pathway. In this video, we will wrap up by talking about documenting the assumptions and rationale of a theory of change. Let's get started. Teams document assumptions and rationale to provide a clear illustration about how and why the theory of change will work, and the connections between each step in the pathway of change. Documenting assumptions and rationale helps teams convey all of the contextual considerations they have identified, and to show where data and research supports their theory. Teams document their assumptions of why the theory will work at each causal link by considering their expectations, contextual issues, and data and research. Expectations outline the connections between causal links and actions. Contextual issues consider what resources or barriers there might be, including any legislative requirements. And data and research supports assumptions so a team can build the strongest theory of change possible. A brief narrative of the logic and rationale for the theory is an important element to share with stakeholders, decision makers, and potential funders of the actions within the theory. Explaining why the team thinks this will work in a clear and concise way can help to engage these audiences in future steps to address the root cause and problems identified. When teams document their assumptions and rationale for the theory of change, it may be useful to consider the following questions. Has the team explored all of the potential challenges that might prevent them from achieving the causal links in the theory and the overall long-term outcome? For example, has the team considered all of their available resources, any existing or necessary legislative requirements, or other barriers? Has the team investigated the data and looked for additional research that supports their assumptions and rationale in the theory of change? Supporting data and research will strengthen the theory, especially for external stakeholders. Also, teams should think back to where they started developing the theory of change and check in to see if their rationale and logic in the theory is plausible, doable, testable, and meaningful. Answering these questions together as a team will help the team feel confident in the theory of change they've developed, and they will be able to articulate it clearly to stakeholders and other audiences. Let's take a moment to check in on the example. The team has a theory of change with 2 root causes. Let's consider their assumptions for the root cause: child welfare agencies lack access to qualified staff in rural counties. The team identified the pathway of change for the root cause and outlined their assumptions, including understaffing in rural areas stems from a mismatch between agency qualification requirements and the supply of local university graduates. Turnover in rural offices is relatively low. Any modifications to staff qualification requirements must ensure a workforce with an educational background that aligns with the agency's practice model to serve children and families. All new staff in rural offices will complete child welfare training. A temporary plan can rotate staff from other regions to fill some of the staffing gaps in rural areas, as this plan will take time to affect the long-term outcome. Remember, the assumptions are the expectations about how and why the theory of change will work, and they include important contextual information about things like the resources available, legislative requirements, and barriers to change. They also identified and documented their assumptions for the second root cause, and have identified where there is research or evidence to support them. They may also consider writing their rationale for the theory of change in a clear and concise narrative for stakeholders and external audiences to easily understand why the team believes the theory of change will work. The team has now completed the process of developing a theory of change and have set the stage for the next phase in the change and implementation process: intervention selection, design, and adaptation. Before moving to the next part of the change management process, intervention selection, design, and adaptation, it is a good idea for teams to assess whether the critical tasks for theory of change are complete, including: a team is formed to guide the change and implementation process. The information is gathered on the problem statement, root cause, and target population. The change the agency would like to see or long-term outcome is identified. The pathway or pathways of change are developed for each root cause to address. The team has defined the actions needed at each step in the pathway of change. And the assumptions and rationale explaining why the team thinks the theory of change will work are documented. Developing a sound theory of change is a cornerstone for effective change initiatives. But remember that the process should be approached with flexibility and in a feasible way. By having these milestones in place before moving forward to intervention selection, design, and adaptation, teams increase their ability to effect positive change. Let's take a moment to check in on what we've learned about documenting assumptions and rationale of a theory of change. Why do teams document assumptions and rationale? To clarify the expectations and context, identify potential barriers, and strengthen the theory with existing data or research to support the assumptions. How do teams document assumptions and rationale? By considering the expectations and context that might impact achieving each causal link, researching data to support the assumptions, and writing a narrative that is easy to understand. What can help teams to document assumptions and rationale? Exploring potential challenges, gathering supporting data or research, and reviewing to ensure the theory is feasible. As a recap, the essential functions of developing a theory of change include gathering information on the problem, root cause or causes, and target population, identify a long-term outcome, develop a pathway of change, define actions, and document assumptions and rationale. Feel free to go back and rewatch any of the videos in this series to refresh your memory. Remember to use the Theory of Change workbook to reflect on your learning, record any outstanding questions, and think through your next steps. Join us in the next series where we will break down the essential functions of selecting, designing, or adapting an intervention.